I feel like Sandy, I can't tell. Oh, vitamin D for longevity, Dr. Hillary Frederickson.
We're talking about it because it matters for so many systems. Vitamin
Mhm.
D.
And
It's
I am just so frustrated because it's almost every day in clinical practice that I find people not taking vitamin D. It's just the strangest thing to me. In the winter in New England, we just don't get enough sun exposure. It's just a it's unbelievable to me that people are not all on vitamin D. We know so much about it. It's recommended by every agency, whether it's, the endocrinologist, the gynecologist, the geriatric society. It's everyone says everyone should be taking vitamin D in the winter, all adults. And you and I go further, right? We test our patients. How do your patients look?
So we live in California, and I'm in the majority of my patients are California residents. Some are from
Mhm.
Southern California, San Diego area, Laguna
Mhm.
area. These are like the
Mhm.
pockets. And most of us are in the Bay Area. I rarely test a patient that's above 40 who isn't supplementing. So most patients who aren't supplementing are in a very either frankly low or kind of critical. The optimum range, many doctors have different optimum ranges. And you guys have to understand this. There's been a big change in 20 years. When Karen and I went to med school, it was like vitamin D toxicity was way more what we talked about. And there was a
Mhm.
big shift in change in medicine, as there often are, are these changes where now
Mhm.
we're really recognizing that a therapeutic level, or having somebody at a level between 50 and 70, or a good steady blood state level, helps many, many, many systems of the body. The immune system, it helps fight off cancer, it helps hormone balance. So it's extraordinarily helpful in fertility. It's very helpful in menopause and skin cancers. There's on and on and on.
Mhm.
Depression, anxiety. So, and if we're not taking it, I've never ever met anybody that tested above 100, except for one person who was training for ultra marathons in Australia, was getting extreme sun exposure and was supplementing. So like hers was like 99, and we were like, whoa, okay, you can slow down now. Now you
Right. Yeah,
supplement,
you see it with
you
supplementation.
don't supplement too much.
Right. So it's important to get it tested. We're big advocates for this, and sometimes people's insurance pays it, sometimes not. But we'd like to see, especially if you're supplementing, is it getting absorbed? Is it getting utilized by your body? How much is in your bloodstream? Because there is this risk with vitamin D that at really high levels, you actually can get more plaque in your blood vessels and cardiovascular system, et cetera, because of the effect on calcium. So vitamin D helps pull in more calcium, and calcium builds those plaques, and it could get, in your kidneys, et cetera. I think that's really rare. It's more of like this theoretical risk. I'm not going to say I've ever seen it happen where I'm not happy. But if somebody's vitamin D is over 80, I don't really want them to keep supplementing at the level they're supplementing at, because looking at some research, that could be associated with some damage. But that is so rare. I feel like that happens only a few times a year for me in my practice, right, Hillary? Same thing with you, right?
Only a few
Only a
times
few
a year.
times a year, right?
And
And
I
then,
think people really need to know what you just said. This is massively important for preventing osteoporosis. One of the big issues with osteoporosis for men or women, or
Mhm.
osteopenia, is people don't know until they know, like unless they have doctors talking about it. And it is just not something that doctors talk about with 40-year-olds and 50-year-olds. It just isn't. At 60 is when you can screen for osteoporosis with a DEXA scan. I have many patients who do it earlier, where I'm insisting in when we're doing menopause treatment, but
Mhm.
many of them are having to pay out of pocket for their DEXA scans. It's just,
Mhm.
and many, many patients are having a weakened bone structure, and that often is due to longstanding vitamin D deficiency. So
Yes.
depression, anxiety, suicidality, bone strength, it just goes
Mhm.
on and on and on the list. And vitamin D is a hormone. So we test it like a hormone. We're
Mhm.
often testing hormones for our hormone patients. If we're working with patients, we're testing
Mhm.
their estradiol, their cortisol, their progesterone, their thyroid. They're
Mhm.
looking at different things. Vitamin D is a hormone. It's really important. And we want to talk to you about two.
Wait, why is it called a vitamin? It's one of those things in medicine that is mislabeled. So if we found it today, if Hillary and I were like, "Wow, what's this thing?" "Oh, it works in every single tissue in the body, and every single cell has these vitamin D receptors and all of this stuff," it would be called a hormone. It would be categorized a hormone. We just call it a vitamin. Maybe because well, there are hormones in foods too, like pistachios have melatonin, for instance, but vitamin D is in some foods, and we all often think, "Oh, I can get all my vitamins from foods," but that is not true with vitamin D. Not at all true with vitamin D. You cannot get it in your diet at an adequate level. I think we've all established that, right? You can eat cold water fish like salmon will have it, mushrooms have a little bit, maybe egg yolks have a tiny little bit, maybe some dairy products. It's just not, you're not going to get the levels that we really want to see you with. And the other thing that I think is often the underlying cause of people's being really uncomfortable and having muscle cramps at night and just muscle tension is that their vitamin D is low. So that's
Grow
another,
growing pains in
musculoskeletal pain
children.
is a big one.
Growing
What's
pains. Growing
Oh,
pains
yeah,
in
growing
children
pains,
is
definitely, yeah,
very often a vitamin D
right,
deficiency.
right.
It is not normal.
Mhm,
Like, to me, growing pains, extreme growing pains are not normal, and we have
mhm.
to make sure that the vitamin D is there. So the interesting thing is we convert it in our skin when we're outside. So if you, in the winter, in the Northern Hemisphere, if you are above the Nashville line, like, I'm not really sure why they chose Nashville, but if you draw a line from Nashville
Mhm.
across the country and you live above it, you are not converting any vitamin D from your skin based on the sun.
Or enough, yeah.
Or,
You probably get a little tiny
but,
bit with your
or
eyes that are peeking out of your goggles or whatever when
you're
you're
not getting enough. And most people, what's happening is as we've moved indoors and we're not outdoors farming all the time, where we are
Mhm,
just not getting enough sun exposure. And then
mhm.
when we do get sun exposure, many of us are wearing sun creams on our face. So what is showing is covered up. There is sun protected, meaning that, and many of those that block vitamin D. So there's a lot of reasons why we have vitamin D deficiency, but even in the southern cities, so like San Diego, like I said, I have a lot of patients in Laguna and San Diego. That's underneath the Nashville line. They should be getting some vitamin D conversion. Everybody is still so low.
Well,
Generally,
we wear sunblock, right? Like, basics cream has sunblock, so that'll block it. People with darker skin have a really hard time making vitamin D, and as you get older, you have a harder time converting the vitamin D and having enough, so older people are classically deficient in vitamin D, and I think that one of the biggest things in, expanding lifespan and this biohacking for longevity is vitamin D. If you ask anybody who's really biohacking, what do they take? There's gonna be vitamin D on there. I've never seen an article or met anyone who's biohacking who's not on top of the vitamin D because you just have so much research here. And I can't say necessarily that, oh, it can prevent cancer, but there's some research to support that. So it's probably anti-cancer, probably anti-diabetes. And it just has so much going on that it's really important to take it. But the other part of this is that many people can't do that whole thing, converting it from the sun, or their body can't convert it properly. Vitamin D has to go through a few steps. And so this is where the genetic variation comes into play. Many people over the years, I've just been surprised. Wow, they're taking this much, their level's still low. What do we do? What do we do? And before we had the genetic testing, it was hard to figure out. But now we have these genetic tests that tell us where this vitamin D receptor issue could be. And so there's a bunch of these things called SNPs, which are just variations. Hillary and I have different ones, but they both mean that our vitamin D is not properly functioning in our body. So we have to take more than the recommended amount that the
I have
government says. So
two
it's
genetic SNPs that I had no idea about. I
right.
just had always tested myself, had been low, had assumed it was from a chronic infection. I had a Lyme disease infection from early on. That's what doctors were considering. Like, why do I have to keep taking so much of this? As soon as I got my genetic test, it just became really clear. Oh, this is not from some random infection that I have. This is because I have I have 2 genetic SNPs on my genes, which means I do not, 1, absorb it well, or 2, transport it well. So I'm doubly down on my vitamin D genes. And if I didn't know that, I wouldn't know that I actually just need to take almost double the amount that I normally give my patients just to maintain the basic level I want maintained. So that was really potent information for me and my journey. And fortunately, I grew up in Las Vegas and we didn't wear sunscreen in the 80s. So I was probably okay in the early years. And I went to school in Boulder, Colorado. I was outside a lot. But the years we lived in Seattle, when none of us were taking vitamin D and there was no sun, or the years I lived in Boston.
Our natural environment was the coffee shop in Seattle. Like we didn't see any sky
never in the sun. I had we both, like, if you look back there, I had like dark red hair. Kara had dark hair. It's hilarious. Our pictures. And when you look in the northern latitudes, the rates of depression, the rates of suicidality go up. And that's been linked to vitamin D. So this is like a really important health issue. And we just want to highlight, 1, getting tested blood-wise, but 2, knowing what your genes are, your vitamin D genes, can make an enormous just picture of the piece of the puzzle that gives you a lot of good information about your dosing.
A lot of you are walking around thinking, oh, I do take my vitamin D every day, but we don't understand really how your body is processing that. So getting these tests is really important. So if you want to hop in on our program for the genetic testing, just click below. You'll get the information on it. We're happy to actually directly meet with you to talk about this. So hop in. It's really important for health. This is one of those key anti-aging regimen things that everybody's on who's into anti-aging. So figure out what your number is and figure out what your genetic predisposition is. All right, Hillary, I'll be back. We'll be back in a few days more with dementia and longevity talking.
See you soon, sweetie.
Bye.